My name is Thomas Cotter, currently the Advanced Hepatology Fellow at the University of Chicago Medicine. On behalf of my mentor, Dr. Michael Charlton, I am delighted to be here to present our poster entitled, How Much Alcohol is Bad for Your Liver? Firstly, let's learn how to measure alcohol content in drinks. This is very important as drinks come in all shapes and sizes. You multiply the volume of drink in milliliters by the percent alcohol by volume, then divide by 100 and you get the milliliters of pure alcohol. Then you simply multiply your answer by 0.8, which will yield the weight in grams of alcohol. You can work through a common example here of a bottle of beer, and you'll see that a bottle of beer contains 14 grams of pure alcohol. This is the equivalent of one standard drink in the US. This picture here illustrates one standard drink in beer, malt liquor, wine, and also in spirits. Let's move on to see how your body handles alcohol when you consume it. Alcohol is easily brought to your liver and your bloodstream from the stomach and upper part of the intestine by a process called simple diffusion. It only takes about 20 minutes for your maximum blood alcohol concentrations to be reached. Importantly, food decreases and delays alcohol absorption, which is why you should never drink on an empty stomach. Have a look at the diagram here. You can see that on an empty stomach, your blood alcohol concentration reaches this high. However, it's substantially less if following a meal. There are some other groups of people who may be more sensitive to alcohol than others. For the same amount of alcohol ingestion, women have higher levels of alcohol in their bloodstream than men. Certain weight loss surgeries, such as bariatric surgery, can also lead to higher alcohol levels. Let's look at why alcohol is toxic to your liver up here. So when you consume alcohol, it causes multiple things to happen within your liver. It affects the DNA expression, causes protein damage, it increases fat storage, it causes a process called oxidative stress through free radical release, and then it causes a lot of inflammatory mediators to be released. All these culminate in cell inflammation and death, and subsequently scarring or fibrosis, and ultimately end-stage liver disease or cirrhosis. Finally, let's explore what is safe alcohol drinking. There are a number of things which places you at increased risk of alcohol liver disease. The more alcohol you drink, and for the longer duration you do it, the more increased risk you are of alcohol liver disease. Drinking more than 2 standard drinks daily, drinking in between meals, binge drinking, can also increase your risk of alcohol liver disease. And then subsequently, there's other things like genetics, underlying liver diseases such as fatty liver, hemochromatosis, viral hepatitis, and women are also at increased risk compared to men. So finally, what is safe alcohol drinking? The leading organizations in the US have recommended 1 standard drink daily for women and not more than 2 standard drinks daily for men. Averaging less than this is recommended. And avoid binge drinking, which is 4 drinks for women or 5 or more drinks for men at one sitting. I would like to thank you very much for your attention and hope you found this educational and useful. Thank you very much.